This is an MRI of a 52-year-old gentleman who presented to my office with acute lower back pain and L5 radicular symptomatology. Most notably, the patient had 4/5 weakness of left foot dorsiflexion, for which he underwent neurosurgical evaluation and this MRI. The neurosurgeon strongly suggested surgical intervention. The patient was adamantly against having surgery, so he sought care at my office on the referral of another patient. When I reviewed the MRI, we can see on this sagittal view, this parasagittal view, some inflammation and edema, a Modic 1 change of the inferior end plate of L4. We can appreciate some increased signal of the L4-5 zygapophyseal joint indicating a true synovitis. And we can see that corresponding inflammation within the posterior joints bilaterally on the axial view. We can see quite significant signal intensity and also a small synovial cyst that the radiologist measured at 4.38 millimeters. There's substantial degenerative change of those posterior joints, the thickening of the ligamentum flavum with intrusion into the IVFs and the posterior spinal canal. The patient adamantly did not want to have surgery, so he asked me to try some care. I started with some flexion distraction, but the patient reported some discomfort immediately. So I changed over to axial intermittent traction, and he reported substantial relief immediately while he was on the table. I did that for about 4 weeks, and progressively the patient got better. The foot and dorsiflexion strength improved. Radicular symptomatology progressively centralized. He had some lower back pain, and we progressively reduced his frequency of care to the point where he now seeks my care on an as-need basis. If this case was of interest to you, please go to PostGradDC.com for advanced continuing education.